Welcome back. We often hear about the billions that are lost due to the ban on the sale of tobacco products. But here's the other side of that story. Between January and August of last year, the George Regional Hospital, as I reported before the break, saw a drop of 70% of emergency visits for respiratory issues. Let's find out from Sharon Nyatsanza from the National Council Against Smoking, who joins us this morning. Sharon, I'm hoping that you can help me understand. Do you think this was as a result of people not smoking, or do you think this had to do with people who were too afraid to go to emergency rooms? Good morning.
Good morning. Yes, so, the study emanates from observations made at the Georgetown Regional Hospital in the Western Cape. So what they found is that compared to 2019 numbers, during 2020, where we had the lockdown, the COVID-19 lockdown, tobacco sales ban, there was a rapid drop in the chronic obstructive pulmonary disease, the COPD cases. And they also looked at the various factors, for example, like you mentioned, whether people were too scared to visit the hospital or whether people were just, there were restrictions on movement. So they did control for all those factors. And they also compared, the cases of urinary tract infections, and they saw that there was also a drop in urinary tract infections, but only a drop of 30%. So when they looked at, the COPD, the lung, cases that were recorded in the emergency unit, they saw a remarkably drop in those cases. And the study has concluded that this actually was part of the tobacco sales ban was part of the reason for this, significant drop. Not only because some people had stopped smoking, but because some people had reduced the number of cigarettes that they smoked.
Help me understand, what does South Africa, though, Sharon, do with this research that's come out? I don't think it would surprise anybody that if cigarettes were banned, that the drop in respiratory diseases would also be so exponentially high. We all know smoking is bad for us. This is not new breaking news as far as science is concerned. What are you, as the National Council Against Smoking, are hoping to get out of this kind of research?
Yes, so, this research, although, it talks about the artificial restriction in tobacco sales, what it also shows is that when we control tobacco using other measures, like, for example, the advertising bans, using, for example, the 100% public smoke-free areas, that this can actually result in reduction in the disease burden. So the study actually also mentions studies that were done in Canada and in Ireland, which actually shows a drop in COPD cases when stricter tobacco control laws were put in place. So yes, the study was done in the ban, but it actually paints a bigger picture of the effectiveness and how useful tobacco control measures could be for the country.
I think many South Africans, Sharon, and I'm sure you'll agree with me, I think many South Africans, off the back of the various lockdown levels that we've had, the various restrictions and the word you use, controls, put into place, I think is upsetting to a lot of South Africans because of the restrictions we've all gone through. Why do you still think there's the need to control what people decide to do with their own health? I'm not arguing that it's unhealthy, but those who do smoke are still going to argue with you, and I'm sure you know this argument, that you're trying to control what they do. And I think South Africans are very sensitive to that right now, aren't they?
Yes, they are very sensitive, and we understand that. So tobacco control measures are still in place. They've been in place, and since 1994, there was a Tobacco Control Act. But what we saw during that period was a drop in smoking rates from 32% to about 20% in 2010. And since 2010, now it's almost 12 years later, the smoking rates have now not changed. So they've kind of stagnated. And this actually calls for better controls in smoking. And this doesn't mean that people cannot access their product, but it also means that we create an environment that is more friendly for people to stop smoking. But more importantly, we actually create an environment which stops the younger people from starting to smoke. As I'm sure you know that 8 out of 10 people start smoking as children. When they actually do start, they don't really understand how serious addiction is, and most of them actually grow into subsequent tobacco users. So tobacco control is important for both people who smoke. It's also important for those who have not started, but it's also important even for the 80% of South Africans who do not smoke. We still get a lot of complaints about people who are involuntarily exposed to second-hand smoke. So it actually does sound upsetting, but it doesn't actually stop access to tobacco products for those who choose to do that. But we kind of hopefully try to create and encourage a tobacco-free society using this control.
Sharon, final question to you, if I may, just in the last 30 seconds that I have with you, if you could. What do you tell government, though, when they say that they've lost billions due to the ban on tobacco products? This is still a major economy driver for the country. I'm not discounting health, not at all. Please don't attack me on Twitter, I'm really not. But what do you tell government and the tobacco industry when they've lost jobs, thousands of jobs, billions of rands as a result of the tobacco ban, and you're now calling for even tighter controls on the tobacco ban? Final question to you.
Okay, so what I do, what I would tell you and the government is that tobacco control does not harm the economy. It actually does support the economy because health also is costly. So South Africa loses 42 billion rand from treating tobacco illnesses and from deaths from tobacco. So when you talk about the economics, we have to talk about both sides of the story. So what I see more prominently is just one side of the story, but people don't also focus on how expensive it is to smoke, how expensive it is to the health system, how expensive it is to the economy.
Sharon, I appreciate your time in speaking to us this morning. Sharon Nyatsanza from the National Council Against Smoking, on that report that 70% drop in the cases as far as the smoking cases down in George were concerned. It's this report coming out a while ago talking about respiratory cases dropping at the George Regional Hospital. My thanks to Sharon speaking to us this morning.